Memento Health is an easy-to-use and secure web application dedicated to creating fully customizable forms to be used by healthcare professionals to assist in gathering, analyzing, and managing patient data. Think about the last time you were at a doctor's office. You were given a paper form that took a little while to fill out. You gave it back to the assistant, who then probably took another 10 minutes or so to take that information, put it into the system before you could even be seen by your doctor. Memento Health aims to solve this issue by creating a quicker and easier patient check-in process that will lead to higher healthcare quality and make the organization of patient information easier for staff. When it comes to patients' health information, privacy is of the utmost importance, and to that end, our application incorporates a role-based security system to ensure that only authorized users that have access to patients' private healthcare record. Furthermore, user accounts are required to have complex passwords and are secured through the use of lockouts, two-factor authentication, a PIN lock, and session timeouts. We only collect and retain information provided by the patient with their express consent. No information is collected in the background or without the patient knowing. However, we have no control over the type of data that providers might collect from their patients. In order to solve the patient check-in issue, we utilized C# as our programming language on the Visual Studio IDE, the ASP.NET MVC framework, the Entity framework, and the SQL server for the backend. We used HTML, CSS, JavaScript, jQuery, and Bootstrap for the front end. GitHub was used for code collaboration and task management, and Discord was used for communication. While we were engineering the project, we designed a few different requirements, use cases, and user stories and diagrams, and this allowed us to create nearly 50 features, such as the ability to create fully customized forms, conditional flow, and role-based security. But we would rather show you than tell you, so we're going to go ahead with our demo. So let's say Yonatan here is the provider admin of the OU Health Clinic. He lands on the user manager page where he's able to access all of the clinic staff. For example, Bobby recently got his medical license and his role needs to be changed. So the admin would go to edit Bobby's user, change the role to doctor, and he would hit save. Now we can see that Bobby is listed as a doctor, but also Tom recently left the clinic and his account needs to be locked out to prevent him from logging into the site. So the admin just hits the lock button next to his name. Now, the admin would like to enable two-factor authentication for his account in order to add an extra layer of security. So he goes to his account manager by clicking the hello link at the top and hits enable under two-factor authentication. And the next time he successfully logs in with his password, he's also going to need to input an additional security code that was sent to his email address. So now, the admin would like to create a patient check-in form. So he goes to the form manager by clicking forms at the top. And we can already see that he's created multiple forms, which are listed here along with their name, the number of questions, and the number of patient submissions. But we want to create a new one, so we're going to hit create. We're going to choose the form name. We'll make it pain check-in, and hit create. We want to add some questions to this form, so the admin will hit add under questions next to the newly created form. And the first question we want to ask the patient is tap on the body pain area. We're going to say it is a required question, and we're going to make sure that the answer type is image. And then the admin will select the body image from the file on his computer. So now we want to add a second question after that one by hitting the plus icon. And we want it to ask to tap on the head pain area. We'll say again it's a required question, and we want the answer type to be image as well. So we will add the other image from the computer for this one. And now we're going to add the question, do you have any allergies? This is also going to be a required question, but the answer type this time is going to be radio buttons. We're going to add a label, and we're going to make one say yes and one say no. Now we want to add a fourth question that asks the patient to select their allergies. We want to say it is a required checkbox type question. And we're going to add the labels for some of the most common medical allergies, which include penicillin, ampicillin, ibuprofen, and to cover our bases, we'll make the last one other. We'll hit add. And the next question will handle that other under the allergies. So we're going to add another question, and this time we're going to ask, what else are you allergic to? This is also going to be a required question, and since it's already text, we can just hit add. We're going to add one more question, that is, how many painkillers have you taken in the past 24 hours? We're going to say it's not required, so we're not going to hit the box, but we're going to make the answer type a numeric answer. We're going to add that, and the last question we'll add on this one is, when did your pain begin? We'll say it's a non-required question of the date type, and we'll hit add. Now we want to mess with the order a little bit, and we want to switch the last two questions. So we're going to hit the move up next to the bottom question, and we will see it switches places. Let's actually add another question under the first image question. So we'll just hit the add button, and we're going to say tap on the feet pain area. We'll say it is a required question, and this is also going to be an image type. And it shows up right where we want it to, which is as the second question. So the graph just shows at the very bottom of the page, typical question progression of next, next, next until the end. So we want to add some logic to this form. We'll start by adding a condition to the first image question that says, if the answer is in one of the head areas by selecting them, we'll go to the head question. We're going to add a similar condition for feet. And lastly, if the answer does not match any of the added conditions, that is, if it's anything else, go to the do you have any allergies question. Then the admin adds a condition to the feet question to skip to the do you have any allergies question, no matter what the answer is, so that the head question is skipped since we're not addressing the head. Now the admin adds a condition to the question asking the patient if they had any allergies. If they said yes, we want them to go to the allergy selection question. And if the answer is no, we're just going to skip to the when did your pain begin question. Next, the admin wants to add a condition to the select your allergies question, where if the answer has the other box selected, it's going to go to the what else are you allergic to question. Otherwise, it jumps ahead to the when did your pain begin question. We'll go back to the question list, and if we scroll all the way down, we see that that graph has been updated with the conditions we added. The graph helps visualize the flow of the questions with all the conditions that we've added. Now the form is complete, and we can go ahead and publish it by going up to the form, hitting publish, and confirm. Now that the form's been published, we're going to have the assistant take over. And before he can start the patient check-in process, we want to import some patients that he exported from the patient's clinic management software into our web app. So he goes to patients, selects import, and we will choose the exported file and import that into our site. We can see that 20 patients were added successfully. One patient was updated. She probably got married and changed her last name. 5 lines were invalid in the CSV file. Some of them might just be a missing patient name. Some are missing the birthday. Some have invalid birthday formats. Lastly, 5 patients were already in the system. So the assistant goes back to the list and sees the updated list of patients. And we'll say Jack just came into the clinic. He wants to check in when he says that he's in pain. The assistant will go to the patient search, types in just the letters JA, and hit search, and we find Jack in there. We'll hit new under submissions to start a new form submission. We'll select pain check-in and hit start. The website's now locked and only can be unlocked using the assistant's PIN code, so the patient cannot do anything other than answering this form, and so the patient is given the device. At the top, we can see that the patient details are correct. We can also see the number of remaining questions. So he will go ahead and select his pain areas by clicking on the head and hit next. The form has taken the patient to the head question because he already selected the head as the conditions we gave him. And then he selects the ear. Actually, we'll change that to the nose. And we'll hit next. He does have allergies, so we hit yes and hit next. We will say he's allergic to ampicillin and other, and he's taken to the other allergies question. He tries to hit next without putting anything in, but he's greeted with an error, so he'll hit OK, and he remembers he has to type in his allergy, which in this case will be aspirin. We notice how the progress bar at the top is changing, the number of remaining questions are changing as we go. And the patient does not remember when his date of pain began, so we just hit next. In the past 24 hours, he's taken 1 painkiller, so he'll type in 1. And this is the last question, so we see review answers. He lands on the review answers page, where he can review them. And the patient just remembered when his pain began, so he hits change answer next to the blank one for that question. We'll have him select yesterday's date, and it jumps back to the review page. We can see the answer is now updated. Everything looks good, so we hit submit. Patient is presented with a completion screen. He cannot do anything else from here, so we let the assistant take back over control. The assistant will hit the unlock button at the top of the screen and type in his PIN code. And we land on Jack's submission page where we can see the start and end times, and it has taken Jack this long to complete the form. Let's say a month passes, Jack comes back into the clinic. Since he's already filled out a form, the assistant can just clone this submission by hitting clone and confirm. And now all of his previous answers are copied over to a new submission, and Jack can just modify the applicable answers. So we'll hand the device back over to Jack. We'll say today the patient's right foot hurts, so he selects the right foot and hits next. And he's now taken to the feet question instead of the head question as happened last time. He remembers it was actually the left ankle, so we're going to go back to the previous question. And we're going to switch that over to the left foot. The patient's answer is still here from when he selected it, so we hit next. Sadly, his allergies have not magically disappeared, so we're going to hit next. Neither did that one. And he does not remember when his pain began, so we hit clear answer. The patient has not taken any painkillers, so we clear the answers again and hit review answers. Everything looks good, so we hit submit. Again, locked out, only the assistant can continue from here. The assistant takes back over, hits the unlock, types in his PIN. We'll say another month passes, Jack comes back into the clinic with pain again. This time we're going to start a new submission for Jack, this time by hitting start new at the top. He selects the pain check-in form, hit start. We hand the device over to Jack, and we'll say this time his pain is in his stomach. So we'll click the approximate location, hit next. And we'll say, what if Jack needs to step outside for a second? He hands the device over to the assistant. The assistant will hit the unlock button. And we see here that the submission has not been completed yet. So we can say Jack comes back from whatever he needed to go do. And since the assistant wants the patient to continue wherever he left off, we'll hit continue, and we give the device back to Jack. This is exactly where the patient has left off on the allergies question. And let's say his allergies magically disappeared, so we'll select no, hit next. We don't remember the date, next. No painkillers, next. Everything looks correct on this page, so we're going to go ahead and hit submit. Give it back to the assistant, who will then unlock it like he has previously. And we can see that submission is now complete, where the doctor will take over control so we can see the submission details and the history. Before the doctor can view Jack's submissions, he needs to go to the patient manager and find Jack in the list. So we're going to select patients, hit search, type in Jack into the name text box, and hit search. We see Jack in the results down below. So we hit view under submissions to see all of his form submissions. And the doctor will hit view next to the topmost submission, which would be his most recent. Here we can see all of the submission details, but we want to compare these submissions to Jack's previous ones, so we're going to go back to the patient submission list and hit view history next to the topmost submission. Here, the doctor can see that the patient selected different pain areas on different submissions. If he could scroll down, he can see that the patient's allergies have disappeared for some reason in the latest submission. It might have been a mistake, but the doctor will still refuse to prescribe Jack with ampicillin and aspirin since they were selected in the past. And that will actually wrap up our patient check-in and doctor review portion, so we will move on to the system administrator view. So let's say we have the system admin for Memento Health. He just landed on the provider management page, and as a system administrator, he can see all the providers that are registered on our website. We can see all of the contact information, the number of forms, patients, and staff of each provider, and if he hits view stats at the top of the page, because the sysadmin was not on the device for some time, we saw that the session had expired, and to help secure the actions and information visible to him, we must log in again before we can continue. On the status page, the system admin can see various information such as the total number of providers, patients, forms, users, and submissions, and the averages per provider. He goes back to the list and wants to see who manages the OU clinic, so he'll click details next to it. And when he scrolls down, we can see all of the administrators for that clinic along with their contact info. And as a sysadmin, he cannot see providers, patients, forms, or staff other than the provider admins. This is done to protect the data and privacy of the subscribing clinic's patients. Now the sysadmin wants to help manage other system admins on the website, so he goes to the user manager by hitting users at the top, and here we can create new system admins and see all of the existing ones along with their contact information. We can edit their info, delete them, lock or unlock their accounts as was shown earlier. And we'll log off, go to the home page. That concludes our demo.